Good morning. My name is Dottie Gallagher, President and CEO of the Buffalo Niagara Partnership. Welcome to session number 1 of BNP's Preparing Your Business for COVID-19 Vaccines, our Webisode series, presented by Highmark Blue Cross Blue Shield. We thank Highmark Blue Cross Blue Shield for helping us bring this important conversation to the business community. The COVID-19 pandemic has tested the Buffalo Niagara region, our country, and the entire global community in unprecedented ways. Every community has lost lives, and the economic and social costs of this pandemic are not fully known. Just this morning was reported that 47,000 people are hospitalized across the United States right now, which is as high as it was, or higher than it was actually last March. Getting back to life in Buffalo Niagara, back to seeing our loved ones, back to school and back to business requires we turn the tide against COVID-19 and create a stronger, healthier future for our community. We know that vaccines save lives, and we can return to a greater sense of normalcy to our daily life. And we, as the business community, have an important role in our region's successful vaccine distribution and adoption strategy. As multiple vaccines authorized by the FDA are distributed, and New York State continues to expand vaccine eligibility, we remain committed to sharing trusted information about COVID-19 vaccines with the business community and helping regional companies create effective vaccination plans while communicating helpful information to your employees. As we enter the next phase in COVID-19 recovery and eradication, the purpose of our 3-part series is to provide businesses with vaccine access information in consultation with our local government entities, New York State, the CDC, the U.S. Department of Health and Human Services, and we rely on good research from the U.S. Chamber and the Health Action Alliance as well. Today's conversation will focus on where and how employees can get the vaccines, the proven safety of the vaccines, as well as related insurance, legal, and HR issues that go along with getting shots in most arms. Next week, we'll discuss how to best create a vaccine policy and plan that engages all of your stakeholders. And on April 30th, we will talk about how each company's vaccination plan should include thoughtful education and communication in order to be successful. There's a lot of research that really talks about how we should be talking to our employees about the vaccines and what works and what doesn't. Essentially, the short version of this all is that people who are vaccine hesitant need to hear from trusted resources about the vaccine's safety and efficacy, and employers are going to have to play an important role in closing that gap so that we get to herd immunity. In total, this series is designed to help employers create a clear COVID-19 vaccination policy for their workers and vendors and contractors that encourages vaccination, reduces barriers, and makes it easy for people to get vaccinated when it's their turn. Communicate with employees, workers, and customers about safety and benefits of the vaccines, and reinforce the importance of masking and social distancing to prevent the spread. Creating a safe workplace culture where all workers feel supported, and strengthening vaccination efforts in the regional community. And the partnership has been deeply involved in that effort as a member of the Regional Health Equity Task Force and vaccine education subcommittees. We encourage everyone to visit thepartnership.org to register for sessions 2 and 3, which are the subsequent Friday mornings, and COVID-19 resources and impacts page that we've put up, where we keep updated information on vaccine access, education, policy, communication, as well as our other events. If you need specific guidance on a particular situation, you can use our business link on our homepage and ask a question, and our team of experts will contact you with an individual response. While on our website, we encourage you to take a look at our wide range of other upcoming events, including our 30th annual Athena Awards on April 28th. The Athena Awards is the region's most prestigious event, recognizing the professional accomplishments of exceptional individuals and organizations dedicated to the advancement of women. And it's hard to believe we've been doing it for 30 years. Today, we're fortunate to be joined by 3 experts in their respective fields who will answer your questions and the questions you're hearing from your employees. Dr. Gail Burstein is the Commissioner of Erie County's Department of Health with a special focus on efforts to control COVID-19. She's no stranger. We see her and she gives us comfort on television frequently. She's led the Erie County's response to the COVID-19 pandemic by managing the department's public health lab testing, diagnostic and antibody testing clinics, enforcement activities, public health communications, and COVID-19 vaccination sites. Then we're going to hear from Dr. Mark Perry, the Senior Medical Director at Highmark, Western and Northeastern New York. Dr. Perry oversees the development of medical policies to ensure high quality and appropriate healthcare is delivered to its members, and the organization's internal expert on vaccines. James Grosso will then present. He's a partner at Phillips, where he counsels clients on workplace policies and practices, legal compliance issues. His practice includes representing management in collective bargaining negotiations and defending management in labor arbitrations. As time allows, there will be opportunity to ask our three presenters questions using the Q&A function at the bottom of your screen. We're actually going to take questions for Dr. Burstein immediately after her remarks. Please type your questions in there. And if you go to type in a question, you see one that's similar to what you want to ask, please like it, because that will upvote it, and we will move that question to the top of the list. If we run out of time, and I don't think we will, I think we've got a good solid amount of time today, but if there are any unanswered questions at the end of this session, our team will send out your responses early next week. Every question will get answered. Also, we will flash an event survey in the chat thread, and we'd love to hear your feedback, and it's a very brief, just handful of questions survey. With that, I would like to introduce Dr. Burstein for an update on our community's current infection and vaccination rates, the efficacy of the vaccine, and ways for employers to connect with vaccine opportunities. Welcome, Dr. Burstein. Maybe we need your sound on.
Yes.
Are you there? Okay.
Here I am. Sorry.
Okay. No worries.
Pressing the button. Good morning, everyone, and thank you for getting up early to hear all about COVID and about the vaccines that will help protect us. Next, please. So what I'm going to do is first talk about where we are with COVID-19. I'm going to present some data just so you know about the magnitude of the problem and where we are just in terms of number of cases and hospitalizations. And then I'll show you where we have some data on our Erie County Health Department website. And then I'll go and talk about a little bit about vaccine and about the safety and effectiveness and how you all might be able to get vaccinated if you haven't already. Next, please. Oh, sorry, I should say it this one. So first of all, I'm going to talk about some data. So so far, through on April 14th, we have had over 80,000 unique COVID-19 cases reported to Erie County. So 80,902 unique COVID-19 cases. In the past 7 days, there were 3,593 new cases reported to the Erie County Health Department. So if you do the math, that's over 500 cases a day. That is a lot. We are at a place where we are seeing really high numbers. So that's giving us a case rate of 391 new cases per 100,000 population over the past 7 days. And that's actually a rate that the CDC used to determine where we are in terms of risk of transmission. High risk transmission, the highest level of transmission, is anything over 100 new cases per 100,000 population in the past 7 days. And we are almost 4 times that. So we're in a really bad place right now. Just in terms of hospitalizations, which really always reflect the community prevalence, we are also seeing a large number of cases in Erie County. So as of April 13th, there were 325 COVID-19 patients admitted to hospitals in Western New York, of which 75 were in the intensive care unit. As far as Erie County hospitals, there were 283 patients admitted to the hospitals for COVID-19, of which 67 were in the intensive care unit, 42 were on airway assistance, and unfortunately 6 had died in the past 24 hours, which is always so sad. Next, please. So just looking at some trends, where we're going just in terms of hospitalizations, and I can tell you we are not going in the right direction. We are seeing increasing numbers of hospitalizations every single day, and we're also seeing a trend to younger age groups that are being admitted to the hospital. So just in terms of new cases, We're seeing, again, increasing number of cases, every day. And then the trend is we're seeing higher positivity rates, in every age group, especially among young children. But the highest numbers are in the age groups of their 20s and 30s. And those people are really driving the transmission, and really driving the case numbers in our population. And so you're saying, like, what's new? Why are we seeing all these high numbers now? Well, I think it's a combination of a perfect storm circumstances. So people are just returning from spring break now, and they've been to warm places where we know they're very high prevalence. And we're seeing, especially in the schools, people returning from spring break in the Carolinas or Florida. And, many people, unfortunately, are returning not only with a suntan, but also with COVID-19. We're still seeing, people with cases after having been in different types of gatherings, small gathering, large gatherings. We're seeing a lot of outbreaks in workplaces right now, daycares, restaurants, other types of businesses where people are in their cubicles, but they're, not wearing their masks at work. And then we're seeing a lot of people just with prevention fatigue, especially when we do the case investigations. People are just uncooperative. They don't want to tell us who their close contacts are or where they work, so we can reach out to their contacts and make sure that they understand they've been exposed and put them in quarantine and recommend they get tested. So it's it's been really frustrating, and people don't want to wear masks. People don't want to get tested to know that they're sick. So that's not helping us go into the right direction. The good news is that in terms of our vaccination numbers and our rates, those are increasing. So more and more people are getting vaccinated in Erie County. And I'll show you some specific data about that. Next, please. So these are data looking at hospitalizations over the past 2 weeks in Erie County. The red line corresponds to the total number of people hospitalized for COVID-19 in Erie County hospitals. The light blue line is looking at the number of people in the intensive care unit in Erie County hospitals for COVID-19. The purple line are the number of people receiving some type of airway assistance in the ICU for COVID-19. And the yellow line is, unfortunately, the number of deaths within 24 hours in the hospitals for COVID-19. So, you don't need to have a magnificent grasp of the obvious to see that we are going in the wrong direction for COVID-19. We've, increased almost a third in just the past 2 weeks in terms of admissions. What's also changing with our hospital admissions is, as well as increasing numbers, we're also seeing a change of demographics. We're seeing a younger population. And I think that really speaks to the effectiveness of the vaccine, where we've been very, very effective in vaccinating our seniors, people who are 65 and plus. We have almost 75% of our 65 plus population has received a first dose of vaccine. So it shows the vaccines are working, that people, seniors who have been vaccinated are not ending up in the hospital. So who we're seeing as a hospital are a younger age group. And actually, over 50% of people who are admitted to the hospital in Erie County for COVID-19 are under the age of 65. Also, we're seeing very young people, children. As yesterday, there were 6 children who are under the age of 20 who are admitted to Erie County hospitals. So even young people can become very, very ill. Next, please. So this slide is looking at our new COVID-19 cases by week over the past 6 weeks. So starting from the week ending March 6th and going to last week ending on April 10th. So, again, you can see very clearly in the middle column, there is a consistently, progressively increase in the number of reported COVID-19 cases, where it's almost doubled, where it's actually almost, or more, actually more than doubled over the past 6 weeks. And then the last column looks at, again, our case rates, the number of new cases in the past 7 days per 100,000 populations. And, again, that has more than doubled. And so, this is a really scary time in Erie County. These are very high numbers. These are, the higher numbers than, as Dottie mentioned, that we've seen in a year ago in March. So this is, we're definitely in a new wave. And as I mentioned earlier, Erie County considers any case rate over 100 new cases in the past 7 days per 100,000 population to indicate very high community transmission. So that's where we are, and it's really frustrating because as restaurants open up and recreational opportunities open up and schools try to open up, this is all in the face of increasing number of cases and increasing transmission in our community. So it's really frustrating. And I just think we have to remember, just because you can do something doesn't mean you should do something. And so we just have to be smart about our behaviors, because that's our only way out of this pandemic. Next, please. So this is a map of Erie County, and it's looking at our vaccination rates by zip code, and we also have this by municipality. So in the big picture, the news is good, where 42% of all Erie County residents have received at least one dose of COVID-19 vaccine. And so if you look at the denominator, instead of all residents, just the eligible residents, so that's people that are 16 and up, over 50% of eligible Erie County residents have received their first dose of COVID-19. And other good news is that 28% of Erie County residents have been fully vaccinated, so that they've received both doses of COVID-19 vaccine for Moderna and Pfizer, and one dose of the Johnson & Johnson. And again, if you look at the denominator of just the people who are eligible for COVID-19 vaccine, so people over the age of 16, actually a third of all Erie County residents are fully vaccinated. So that's good. We want to see that number continue to increase. Next, please. So there are 3 different vaccines that are FDA authorized for emergency use in the United States. And those are authorized for use for people that are either 18 and up or 16 and up. So Pfizer, which is the first vaccine that was FDA authorized for emergency use in the United States, is a 2-dose vaccine. The doses are separated by 3 weeks apart, and that vaccine is FDA authorized for people who are 16 years and older. So both 16 and 17-year-olds can get the vaccine. So that's unique with Pfizer. The next vaccine to receive FDA authorization is the Moderna vaccine. Again, that's 2 doses separated by 4 weeks, and that is FDA authorized for use for people who are 18 years and older. And then the third vaccine that was FDA authorized in the United States is the Johnson & Johnson vaccine, which is only 1 dose. So people were really charged about not having to return for a second dose. That is approved for people that are 18 years and up. And unfortunately, because of the effectiveness of our vaccine post-marketing surveillance system, there was some indication that there could be some adverse events that are very serious and associated with the Johnson & Johnson vaccine. So CDC and the FDA decided to recommend to put the Johnson & Johnson vaccine on pause until we can do more investigations to really see if this is a cause and effect relationship with these cavernous venous sinus thromboses that have associated with low platelets, or is really there's no cause and effect relationship, and this is just an association with because we're just see this incidence in the background in our community. So CDC is investigating that, and we'll talk a little bit more about that later in the talk. Next, please. So, vaccine safety is of utmost importance to our public health community. So, every vaccine that is FDA approved or authorized in the United States has gone through tremendous safety scrutiny and effectiveness scrutiny by the FDA. So, fortunately for the all three vaccines that have been FDA authorized in the United States, they all had underwent solid clinical trials. So, and, at least 60,000 people in each trial, and that's the number of people we had in the trials to authorize Shingrix vaccine, to authorize HPV vaccine. That is the standard, and there were no shortcuts taken with these clinical trials. And results of those are available online, so there's full transparency. So vaccines our COVID-19 vaccines were authorized for emergency use by the FDA. And then, the safety monitoring doesn't stop there. There is currently intense post-marketing surveillance that continues to look for signals of potential danger and risk with our current COVID-19 vaccines. And actually, that's a system that is up and running for every single vaccine. And so what the recent pause in the Johnson & Johnson vaccine demonstrates that the CDC's VAERS system, the vaccine effectiveness, the vaccine adverse event reporting system really works. It really does find potential signals of adverse events associated with a vaccine that could risk people's safety in getting the vaccine. And so we were able to detect that through the VAERS system and take action on that. So I think people can feel very comfortable that if you've already been vaccinated, the vaccine that you received is safe and effective. And if you're thinking about getting a vaccine and you're on the fence and you're worried about the safety after this Johnson & Johnson discovery, I have to let everybody know that the two currently available vaccines on the market are messenger RNA vaccines, or mRNA, and those have no associations with the adverse events that were associated with Johnson & Johnson. So that's completely different. And these vaccines, Moderna and Pfizer, are very safe. There haven't been any potential danger signals that have arisen up from our CDC's VAERS surveillance system. Next, please. So when we look at vaccines, just in terms of the FDA deciding whether to approve them for clinical use, we look at the vaccine efficacy and effectiveness. And I know people have questions. Many times these two terms are used interchangeably, but they really do have some slightly different nuances. So efficacy is how well a vaccine works in the perfect world to prevent illness. So this is a number we would see from the clinical trials. If like all stars were aligned and there was no complications in the background, how well will the vaccine work? Effectiveness actually tells us how well the vaccine works in the real world, with human error, people showing up late to get their second dose. So see if the effectiveness is our data that we're looking at now to see the protection, look at the protection in the real world. Because another thing we have to worry about just in terms of effectiveness is how well the vaccines protect us against the variant strains that are circulating in the community. And we are seeing variant strains of concern in Erie County. And our partners at UB, Jacobs School of Medicine, have been identifying variant strains that we've collected and that Collide has collected. And so I think we have to assume that we have to continue on guard because we do have these variant strains that are much more transmissible in our community right now. However, based on the clinical trials and also real world studies, and also I'm going to share with you some information that we have just in Erie County with our experience with outcomes of the vaccines, that we know that the vaccines work very, very well protecting people from moderate to severe illness from COVID-19. Next, please. So yeah, again, I'm going to present Erie County data to show how effective our vaccines are. So just, from our case investigations, from our contact tracers with new COVID-19 cases, what we found in the past week is that 83% of our new COVID-19 cases in the past week were not vaccinated. They did not have a single dose. And then 98% were not fully vaccinated. So they only had one dose, or they may have had two doses, but it hasn't been over 2 weeks since their second dose. So, there were no new cases reported in the past week. There are very few cases reported in the past week of people that were fully immunized. So again, only 2% of our cases in the past week were among people that were fully immunized. So, again, it tells us that the vaccine is very effective at protecting against infections. However, it also tells us that it's not 100% effective at preventing infection. So we still have to keep on our guard even after we've been fully vaccinated. And then looking at our Erie County hospitalizations, the hospital chief medical officers have reported to me just a couple days ago that so far there have not been any patients admitted to the hospitals in Erie County who were unvaccinated or are not fully vaccinated. So we have, again, the vaccine is working, because with the vaccine is authorized to prevent moderate to severe illness and death. And so it is the people who've been vaccinated have been protected against developing such severe disease that they've ended up in the hospital. So people who've been fully vaccinated are not ending up in the hospital because of severe illness. So that is a piece of very good news. Next, please. So, these data remind us that because COVID-19 vaccine is not 100% protective of preventing infection, we know it's very effective at preventing a moderate to severe illness. You can still get infected, and you may still be able to transmit infection to other people. So that's why after you've been vaccinated, especially if you haven't been fully vaccinated, it's very important to continue with these public health prevention measures. So that's wearing a mask whenever you're around people that you don't live with. Make sure that you social distance over 6 feet apart. And then most importantly, if you're sick, please stay home. One of the things that we're finding in our case investigations from our contact tracers is that, there's so much COVID-19 in the workplace is because people are coming to work when they're sick. So we really need employers to make sure that their employees understand, even if they have just mild symptoms, they think it's just a little flu or they think it's just allergies, that they really need to consult with their healthcare provider, or more importantly, get a test before they go to work, because we're seeing, a huge spectrum of presentation of COVID-19, anywhere from people being asymptomatic or to people being extremely ill and hospitalized. So it's really important to know your status and get a test. And so if you, and then also if you are have any type of symptoms, it's really important that you not only get a test, but you just, stay in your own place, stay at home. Don't go near other people that you live with, if you live with other people, until your symptoms have cleared and you know your status that you're COVID-19 negative. Next, please. So I hope that I've enticed some of the business people out there that own businesses or work in businesses to think about, how can I get vaccinated? And I wonder if the county would be willing to come to our workplace to vaccinate our employees. Well, the answer is yes. We really want to make sure that every single person in Erie County is vaccinated who is eligible to receive the COVID-19 vaccine. So we are really eager to work with larger businesses to make sure that to help make sure that they have a safe workplace, and make sure that all their employees who are eligible are vaccinated against COVID-19. So we look at this as a partnership. There are tasks that Erie County Health Department will perform with our vaccination venture with our business community. And then, however, we do expect the business community that is hosting a vaccine pod or points of distribution, which is what we call our vaccine clinics, also takes in some responsibilities to make this operation successful. So what the Erie County Health Department will do if we agree to come to a business to vaccinate people in the business is we're first going to go through the business and make sure that there's a space that is safe and workable to run a vaccine pod. We have to make sure that there's good electricity, that there's a good ADA accessibility, that there are restrooms, good space where people can stay observed for 15 minutes and a socially distanced environment. So we'll have to go and look at the spot before we can agree. We will provide all the staff and the supplies and the vaccines. We will provide a registration link, an online registration link to all your employees at least 7 days prior to the vaccine event. We also have a telephone line at 716-858-2929 if you have employees that would prefer to call rather than to use an online registration link. And then also we will make sure that everybody who gets their first dose makes an appointment to get their second dose at a pod either 3 to 4 weeks after the first dose pod in your workplace. But however, our business partners that want to host a vaccine pod also have some responsibilities. So we will expect you to help us with scheduling, making sure that as many of your employees as possible get scheduled, and put a little bit of pressure on your staff to make an appointment to get vaccinated. This is like a big effort to set up a pod on our part. So we want employers to guarantee at least 50 employees, which can include family members, are able to get vaccinated. So either 50 employees with or without their family members will be able to be vaccinated at our pod. We're also going to need some help just in terms of volunteers and staffing, with greeting, making sure that, people are okay during their a 15-minute observation period, helping to direct people, answer some questions after just-in-time training. So, we'll need some volunteers from the employers. And then also, we'll need tables, chairs that for our vaccination stations, good workspace, and then a waiting area for people to be observed for 15 minutes after the vaccine. Next, please. So we have a lot of great resources on our website. First of all, we have a lot of great information at our erie.gov/COVID19. And if people prefer to get information by phone, by speaking to somebody, or they don't find what they need on our website, you can call our information line at 716-858-2929. Also, to schedule an appointment, you can either go to our COVID-19 vaccine website, or you can, again, call the hotline at 858-2929. If you want to see where we are just in terms of our cases and our hospitalizations, you can go to our erie.gov/COVID map, which shows the number of cases per zip code or for municipality. We also have hospitalization information there about that. And then if you want to get tested and find a great place near you, a convenient place near you, we have a map, an interactive map of all the test sites that are authorized by the New York State Health Department to get to offer COVID-19 testing, and that's at erie.gov/COVID test sites. Just want to mention that our Erie County Health Department offers free COVID-19 testing 6 days a week, and that is on our map too. Or you can call you have to call 858-2929 to make an appointment. Next, please. So we are our Erie County Health Department feel that health communication is very important. We want to give people correct and accurate information to empower you to make smart choices and informed choices. So the county executive and I have a regular video updates every Tuesday at 2:00. Many of the local news stations carry that, but you can be sure to find it on our Erie County YouTube site at youtube.com/Erie County, New York. Also, the health department, we are very active on social media. We have a Twitter. You can follow us on Twitter, Facebook, or Instagram. Also, we have a lot of great information. We work hard every single day to update on our COVID-19 website at erie.gov/COVID-19. And then also, if you want to be on our distribution list for our press releases, you can email Kara Kane, our public information officer, at kara.kane@erie.gov. Also, if you're a business that is considering hosting a COVID-19 vaccine pod, we also ask you to email Kara, and she can help make the connections and set things up. Next, please. So I am ready to entertain questions.
Excellent. Thank you so much for all that great information. And I'm going to, so if you have questions, you can put them in the Q&A. But I've got a couple to get started, and I want to put Dr. Perry on high alert. Question number 3, we want 2 doctors answering. So the first question, I want to talk a little bit about, it's so exciting to hear that you're willing to do these pods. And Dr. Burstein, we're actually organizing employers that are interested, and thank you for putting that criteria in there. We'll add that to our intake form to sort of assist employers to navigate this for you and be your partner on that. So we're excited. So thank you. To that end, when an employer hosts a pod, you said they schedule the second appointment. So do they actually have to have 2 pods, the first and the second shots happen at the employer site?
Yes, with a 2-dose vaccine series, we make sure that everybody gets their second dose. If people only receive the first dose of a 2-dose vaccine, we believe that the vaccine will not give you full protection just with 1 dose instead of 2 dose. And then also, we believe that the durability won't be as long. So the vaccine won't protect as long with just 1 dose compared to 2 doses. And then also, you will not be considered fully vaccinated after just 1 dose. So if you want to go to a Bills game or a Sabres game next year, we're not going to let you in unless you have both doses. So
yeah, my question was more around the logistics scale, that you're going to go back to that employer a second time. It's not like that employees have to go find a second dose somewhere else. You're going to actually do.
Right. We make an appointment for that second dose before you leave after the observation period after your first dose.
Awesome. So you mentioned some concerns that you had about folks in workplaces being a sort of point of contamination, and I want you to help us understand this a little bit, because the most recent data that I saw was that, and this was statewide data, so it might be different in Erie County, which is why I'm bringing it up, that it was only about 5% of the transmission were happening at workplaces, that it was more social events and spring breaks and those sorts of things. Are you seeing a disproportionate number of infections at workplaces in our region? I guess.
Yes, I mean, it seems, again, we can't, we're not doing genetic sequencing to actually pinpoint the source of everybody's infection. However, many people, when we call them and to provide the information of their positive COVID-19 test result and put them in isolation, they share with us where they believe they could have gotten infected. And it seems that, many people are reporting that they believe they were exposed in the workplace because other people at the workplace were ill, or especially that there are people that are wearing masks in the workplace, or aren't being screened to prevent people from coming in when they're sick in the workplace. We're finding people that it's like, oh yeah, I started to feel sick 3 days ago, and I came to work before I was tested. So that's a bad situation.
Yeah.
We're also seeing a lot of transmission in daycares. We're seeing cases in schools, in youth sports, and in churches. Those. I mean, it's really everywhere.
Yeah. So, so Dr. Perry, if you would turn on your camera and your mic for this next question. Despite this very compelling argument that you've made about the safety and efficacy, we have the couple of questions we have are really around a person who doesn't believe that they believe that vaccines are experimental injections and not and authorized for emergency use, is not FDA approved. This issue of sort of vaccine hesitancy and all of that, as you know, and I think you've already answered the question about safety and efficacy, but obviously people are still, there are some people that are still skeptical. What would you say, how would you direct an employer to respond to someone within their workplace who has that sort of level of skepticism? Because as you know, this issue is really around getting to herd immunity, and we won't get there with too much, with rampant hesitancy. So Dr. Burstein, we'll start with you. How would you respond to this person who says, these aren't FDA approved, emergency authorization use is not safe, this is experimental? What would your response be to someone who truly believes that?
First of all, hopefully our employers have been fully vaccinated and they can show themselves an example, say, I was fully vaccinated, and I can tell you honestly, I've been fully vaccinated and my family's been fully vaccinated. And I felt it was safe enough and effective enough to receive my own vaccine. Also the clinical trials that approve emergency authorization use for these vaccines were very large trials and very highly scrutinized by an objective group of physicians with no political ties. And then also we are continuing to conduct a post-marketing safety surveillance for these vaccines. And if there is a problem, we will detect it. So it just I think the danger of people not getting vaccinated is that we're seeing it's not only transmission, but it's transmission of variant strains in our community. And this is really a race against time. It's vaccine versus variant, and the vaccine, we really need the vaccine to win.
Dr. Perry, is there anything you want to add to Dr. Burstein's response?
Sure. Good morning, everybody. And I really appreciate that. Dr. Burstein, thank you so much, and Dottie as well. I think that we have to look at this sort of from two perspectives as well, right? So there's the data, there's the information, and then there's the emotional component. And so, the data information, there are excellent ways that we can track any potential adverse events, as Dr. Burstein mentioned. We know that vaccination really, can save lives. At the same time, people are still fearful. So I think there are times where people need to talk, and that's what Dr. Burstein was mentioning about what I would call vaccine ambassadors, right? So folks that have gotten the vaccine that are encouraging their families and friends. Myself as well, I have been fully vaccinated, and my family is in the process of, my wife she got the J&J, by the way, and she's fine. So vaccine ambassadors, when we think about human nature, it's some of that peer-to-peer interaction that can be so compelling. So I think that as business leaders, if we are able to share our personal stories about our vaccinations, and maybe we had hesitation, that's okay to share. It's something that people need to hear, and there needs to be thoughtful conversation. Sometimes it can take a lot of time. It is worth it. It is very important that everybody get vaccinated for all the reasons Dr. Burstein mentioned.
And Dottie, if I can just add, it would be great if employers, really delve into their employees' concerns about the vaccine. So ask them, like, what are you worried about? How can I help you answer any questions? And if somebody's worried that they might develop, say, for an example, a myth that has been circulating is around infertility. And so somebody said, I've heard that this can cause infertility. So it's really important to acknowledge their concerns, like, oh, I can understand why you'd be really afraid of developing, having problems or having trouble, having a child after you get the vaccine. let me tell you what I know. And so, again, acknowledge people's concerns. The unknown is very scary, and then empower people with accurate information and that you receive from reliable sources. But I think it's really important to acknowledge people's concerns about the vaccine.
We've got, Gail, I want to have you guys hang around for this one last question. There are a few questions that are, I think, better answered by other panelists as we move forward, but this one I think would be good for you to take. I'm confused. This is the question. I'm confused. The vaccine is supposed to prevent the person who is vaccinated from experiencing extreme symptoms, correct? I believe Gail confirmed this. Why is it that we are talking about the vaccine as if it prevents transmission? Why is vaccination being pushed as a measure for protecting family and friends when it does not do that? And so there's some confusion about what the vaccine does or does not do. And so, Gail, I'm just going to give you the opportunity to sort of circle back to sort of clarify.
Sure. Well, we know that the vaccines that are currently available are FDA authorized for emergency use to prevent moderate to severe illness and death from COVID-19. And we also know that they do protect people at some level from transmission. However, it's not 100%. And so the data that I presented earlier shows that there were, over the past week, 98% of our new cases were not fully vaccinated, and so only 2% were fully vaccinated. So that's whereas we know about a third of our population is fully vaccinated. So the proportion of people who are fully vaccinated who are COVID-19 positive is much smaller than the proportion of people who are fully vaccinated in our population. So that shows that there is some level of protection of transmission from COVID-19 from the vaccine, but it's not 100% effective, especially with variant strains. So I think we really want to make sure that we quash any type of risk of transmission. And so that's why, even though people have been fully vaccinated, there is some level of protection against new infection. However, it's not 100%. So we still have to keep our guard up and continue to mask and social distance and stay away from people that are sick, and if we are sick, stay away from other people. Mark, do you have anything else?
Yep.
To add?
Yeah, I would absolutely echo that. And we have to remember that the use of these vaccines began in December, and the studies began last summer. So as we continue to learn more about the, Dr. Burstein had used the term durability, the length of time with which the antibodies that we have create protection, as well as what are called neutralizing antibodies that can help protect against transmission. We're learning more and more about some of these details. So it is, I'll just echo, it's very important to recognize that while the vaccines are extremely safe and effective at preventing moderate to severe illness, hospitalization, ICU, intubation, or other ventilatory or respiratory support, they don't protect against all types of infection. And again, with the variants that are out there, many of which are more transmissible, and there's ongoing research to see whether or not some of these variants might also be more deadly. And there are some reports that I've seen that indicate that a few of them might be. That it is very important to recognize that as Dr. Burstein has said, we're in a race. We're in a race to make sure that we get as many vaccines to people that are able before many variants enter. We need to get to herd immunity. So,
excellent.
Anyway, thank you.
Thank you, Doctor. And Dr. Burstein, thank you for your time this morning. We appreciate you being with us and for your excellent presentation. As always, it's always nice to be with you. So thank you for your time today. Next, we're going to hear more from Dr. Perry, who is the Senior Medical Director at Highmark Blue Cross Blue Shield, about the relationship between insurance coverage and vaccines, as well as how Highmark is communicating its own vaccine rollout. So in the next 10 minutes or so, let's explore that with Dr. Perry. Welcome and thank you.
Yes, well, good morning again, everybody. So glad to be here. Thank you again, Dottie, for your kind introduction. And again, I want to just thank my fellow panelists and especially to our audience. Getting as many people vaccinated as possible, as we just mentioned, is critically important to our whole community, to our community's health. So as shared, I'm Dr. Mark Perry, Senior Medical Director at Highmark Blue Cross Blue Shield of Western New York. And at Highmark Blue Cross Blue Shield, we proudly serve the unique health care needs of our members, employees, and community throughout our long 85-year history. And since the onset of the pandemic, we've taken every step to ensure our members and community have access to the care and information that they need. As the region's leading health plan, we believe the FDA emergency use authorized COVID-19 vaccines are safe, effective, and our best tool to contain the pandemic, as we had shared. And again, with special note of the J&J vaccine being currently on pause, as Dr. Burstein mentioned. So believing and really trusting that these are a safe and effective tool to lead us through the pandemic, we're supporting federal, state, and local vaccination distribution efforts by ensuring the vaccine will be covered at no cost to our members. And we continue to support all the current efforts to ensure proper distribution of the vaccine with special focus on communities disproportionately affected by COVID-19. When you're eligible, and now everyone, as Dr. Burstein mentioned, 18 and up, and with the Pfizer product, 16 and up are eligible, we urge you, I personally urge you, say yes to the vaccine, for your own health, as well as your friends, family, and colleagues. There are many resources available with more information about the vaccine, how to sign up to get yours. And, we've set up a special website that includes clear and accurate information about COVID-19 vaccines, the benefits of vaccination, and answers to common questions and concerns. I know that we've mentioned a few of them previously. Anyone can visit this site as well. It's bcbswny.com/coronavirus. And of course, your primary care doctor is a great resource as well. We understand that there are many questions about the vaccine. This is common. It's very common anytime there's a new medical breakthrough or new treatment that's available, and especially if you're coming after such a year of uncertainty and fear. But there's also much data and science-based research that supports the safety and effectiveness of these vaccines, and the pros far outweigh the cons. And again, special note needs to be mentioned of the J&J vaccine that's currently on pause. Just quick review of insurance coverage, and I know that's very exciting to most people. So the first quantity of doses of the vaccine have been paid for in advance, of course, by the federal government. Our health plan continues to take every step to ensure cost is not a barrier to care for our members. Therefore, we will cover and waive all member copays, coinsurance, and deductibles for the administration of COVID-19 vaccines that are authorized through the emergency use authorization process. Some vaccine distribution locations might require you to provide your Blue Cross Blue Shield member ID card and/or your red, white, and blue Medicare health ID card. And while requirements might vary by location, we encourage that members always bring these documents so that you can be prepared. And we also continue to cover the cost of all COVID-19 related testing and treatment for our members. I want to share a little bit about our organization's internal communications approach, which is very much mirrored our external communications approach, and perhaps is something that business leaders at the meeting today can take home and think about what they might be able to introduce or augment what they've already done. So last March, we've been forthcoming in providing information on COVID-19 and necessary testing, treatment, including vaccines, in addition to providing mental health and telehealth resources to our employees, as well as also to members of the community. I mentioned that we launched a website that has served as the central hub for all COVID-related news and updates over the course of the past 1 year. We also have a dedicated COVID-19 employee news and information site on our intranet, that's internal, of course, for our nearly 2,500 employees. And just as a brief, it's a single screen infographic, I would call it. It's one page that shows the percentage of all members that have completed one dose, and the percentage of all members that have been fully completed with one or two doses, depending on the vaccine product. And it also breaks it down by age range. And then we have a pie chart that shows the vaccine type that had been used. And that's updated on at least a weekly basis for all of our employees on the intranet. So it's just a good way of people to kind of gauge the temperature of where things are. Over the past few months, as the vaccine has been more readily available across the country, and specifically here in our region, we've made it a priority to communicate the benefits of the vaccine and strongly recommend that our employees and members get the vaccine when it becomes available to them. And our numbers, mirror the numbers that Dr. Burstein had shared with reference to single dose as well as fully completed vaccine series. And again, we've seen that our Medicare population, our senior population, those numbers are significantly higher. Much of that, of course, is due to the initial availability for those members as well. And we're hopeful that that would trickle down to everybody else as the supply has really ready available now for those 18 and or 16, depending on the vaccine product. One important point, and what we've been consistently communicating to our employees and our members, is that the vaccine, it's not a ticket to stop all the other measures that we've adopted: social distancing, wearing a mask, washing hands, and staying home if you feel sick. We've also made it a priority to help our employees understand New York State's new law that provides paid time off for individuals to receive their vaccination or vaccinations. So again, transparency, information, and updates on a consistent basis, and really that's been our approach. And I'll close. The vaccine it's very effective at preventing moderate to severe illness if an individual contracts COVID-19. But the important thing to know is that the combination of vaccinations and these measures, they work together to stop the spread. And we truly believe eventually working together as a community, we can all get back to the life that we know and miss, at least to the extent possible. So thank you so much. I look forward to the Q&A session following our next speaker, and I'll turn things back over to Dottie Gallagher. Thank you.
Hello, sorry about that. Can you all hear me? Yeah. Excellent. Okay. Thank you so much, Doctor. We do have some questions, and we're excited that you can stick around for the Q&A. But we know employers have many questions about vaccine requirements and exceptions for employees, as well as the mandate of personal time off for the vaccine, and quite frankly, the time off paid sick leave as well. So our next speaker, James Grosso, Phillips, will help us best understand the legal and HR ramifications of vaccination. And I would say, James, I shared with you some of the comments that we were already getting, but even with Dr. Burstein talking about pods being able to be hosted at employers' sites, any thoughts you have about that would also be helpful. So thank you, James, for being here, and I'll turn it over to you.
Great, thank you, Dottie. I just wanted to make sure, there you go, I'm up. Thank you. So thanks for having me here today, and it's nice to share the webinar here with Dr. Bernstein and Dr. Perry. Let me get right to the issue I'm sure everyone's asking about is, we've heard about the vaccines that we can have them, the Department of Health is willing to come to the work site to administer them. So the question I get a lot right now is, can employers require their employees to get vaccinated? And the short answer to that is yes. The EEOC has issued some guidance that indicates that it's permissible for employees to mandate that their employees be vaccinated to be in the workplace, with two caveats. If you have an employee who has a religious objection or has a medical condition that would prevent them from getting the vaccine for one reason or another, if they're immunocompromised or the like, and they object, so either on medical grounds or religious grounds, then you have to consider if you can accommodate their objection and still let them work in the workplace. So you can have a general requirement for employees to be vaccinated, but if you get objections based on medical reasons or religious reasons, you do have to consider if there's something you can do other than forcing the employee to be vaccinated. And the things you have to consider are, for example, how many people are already vaccinated in the workplace. So if you have a high vaccination rate and you only have one or two employees who are objecting for one of these reasons, that may still be safe enough to allow those employees to work in the workplace, especially if you continue social distancing and mask wearing, et cetera. So, so the takeaways here are you can require those vaccinations, but if people object for one of those two reasons, you are going to have to consider what you can do. And then even if you're in a situation where you would not be able to allow those employees to come into the workplace, you would then have to consider whether you could accommodate them in some other ways, such as allowing them to work remotely. And only then, if they were not able to work remotely, could you even get to the issue of possibly ending up terminating them, which is drastic. And I know most employers really, do not want to get to that point. But legally, that you could ultimately get there if the circumstances warranted it. Another issue is, for those employers who are going to have, say, the Department of Health come on site, that's perfectly fine. You can arrange for that. You have to be careful, though, that when they do come on site, the Department of Health will be asking certain questions about health history, et cetera. So the employers have to be cognizant that to the extent that they are privy to that information, that any medical information garnered in that process is confidential and has to be maintained as confidential. So you want to make sure that you take the steps that are necessary for that. Also, another concern that has come up is, well, an employer may not mandate vaccinations, but they want to know if their employees have been vaccinated. And they want to know, can they ask their employees to let them know if they've been vaccinated? And the answer to that is yes. You can ask employees to tell you whether or not they have been vaccinated. The EEOC has said that's a permissible inquiry under these conditions. But if you do that, again, the response you get from your employees is confidential medical information. You have to make sure that it's maintained confidentially and is not shared beyond the group of people who have a need to know. And then when you do ask that question, you want to be careful that you don't ask any follow-up questions such as, why aren't you vaccinated? Because those type of questions could solicit responses that would reveal confidential medical information unrelated to their vaccine status. That covers the vaccine issues, I think, generally. The other side of that is, we're all aware that New York has passed this recent paid vaccination law, went into effect on March 12th. It will expire at the end of 2022, so it's here for at least the next year and a half or so. And that law requires that employers provide at least 4 hours of paid leave to any employee who takes time off from work to get the vaccine. So there's a couple of requirements there. One is the time has to be time off from work to be paid. So if an employee takes time on a weekend or after work to get the vaccine, that time does not have to be paid. The time off is for each vaccine shot. So if employees are getting the Moderna or Pfizer shot that requires 2 vaccinations, they are entitled to 4 hours for each shot, so up to 8 hours total. Employers can ask for advance notice, so that you can control and not have too many of your employees off at one time. And you can also ask for proof of the vaccination to confirm that they actually went and got it before you paid them. So those are some things to keep in mind on that end. Now, there's a little twist here, benefit. Some of employers may be aware that under the federal law, the Families First Coronavirus Relief Act, there were 2 leave laws passed at the end of last year, early last year, I'm sorry. The Emergency Paid Sick Leave Act and then the Emergency Family and Medical Leave Act that provided leave to obtain COVID treatment, and also if schools were closed to care for your child, et cetera. Those have been expanded to cover leave for obtaining a vaccination. Now, it gets a little detailed here, but those laws are in effect to the extent that employers are not required to provide leave, but if they do, they're entitled to a tax credit. So both of those laws cover employers with fewer than 500 employees, so for mainly smaller sized employers. If those covered employers decide that they want to give leave under the federal law at their discretion for the allowed reasons, they pay the leave up front, but then the employer can apply for a 100% tax credit from your FICA tax. For those employers who are fewer than 500 employees and are required to give time off under the New York law, if you also choose to comply with the federal law, that would give them an opportunity then to possibly get a tax rebate for the time off that they're paying for under the state law. So that's something to keep in mind if you want to possibly recoup the cost that you incur in paying for employees to get the vaccination. And hopefully that would help incentivize employers to encourage their employees to get vaccinated. On the other end, I'll just comment that we have not seen a lot of employers mandate vaccinations, various reasons for that. Mainly, there's been a high voluntary vaccination rate among the population. So a lot of employers have not seen that to be necessary. And also a lot of employers are hesitant to be overhanded or be seen as being paternalistic and requiring employees to be vaccinated. But as I said, that is a possibility. So, I think those are the biggest issues facing employers at this time. And I'm sure there are a lot of questions that employers have related to the vaccine and requiring employees to get it. And if we have some of those, we can certainly address them now.
We do have a few questions, and but before we move on to the Q&A, I just want to briefly set the table for next Friday's session on creating a vaccine policy and plan at your specific business. We've compiled best practices from a variety of sources, including the Health Action Alliance, the U.S. Chamber, and all government agencies involved in the COVID-19 recovery effort. So next week, we'll go into detailed improvements proven steps that lead to a vaccination policy that is led by the correct staff members and can be easily communicated to employees and stakeholders. And we're proud to be joined by Glenn Scott, Vice President of Human Resources at Rich Products, where they'll give us sort of insight on how that organization is approaching vaccination policy and planning. So with that, let's move on to our Q&A. And I think, give me one second here. So there's a question about, there are still questions about employers' liabilities around vaccines, and I don't really understand that, but is there any liability about hosting a vaccine site at all from, and what this person is saying, which can employers be held liable for any possible vaccine damage for an mRNA injection? I don't, I guess, Jim, you could answer that if that
Sure.
Makes sense to you. Yeah.
Sure. I really don't think that there is any liability out there for employers for a couple of reasons. One is if you do host a site, and you make it voluntary, it's going to be the employee's voluntary consent to get the vaccine. And before doing so, they're going to have to sign all of the requisite waivers to do so. And also, even if there could be something related to work, most likely than not, it would be considered a workers' compensation issue. And, it would be very much akin to the annual flu shots that many employers host. And I think, we all have experience with that. And, that works smoothly. There really aren't any liability issues associated with that. So I think we can expect, COVID vaccinations on site to operate similarly.
Thank you. So this one's for you, Doctor. We are now learning that Pfizer will need a booster shot in 6 months. Do you see this trend continuing with other vaccinations? Do you see this booster shot requirement continuing long-term into the future, similar to the flu shot? Also, will employers that have pod vaccination sites also need to provide booster sites? So the last part of that question, I think, is a legal question. But Doctor, what are your comments about that?
So it's such a great question, and thanks again. I would share just for one comment regarding, Jim, is that I am also not aware of any businesses that have made it compulsory to get the COVID vaccine, although I did have some conversations in the past few weeks with some hospital systems in our Northeast New York region where they're looking into it. They do have compulsory flu vaccine. So in New York State, for healthcare workers, it's either you need to get the flu vaccine or wear a mask during flu season. So this one hospital system had made it compulsory to do flu vaccines. It'll be interesting to see where the trend goes with COVID vaccines, given the contagious and potentially deadly nature of it. So back to the question at hand, I did have a chance to look at that on the Q&A. So I appreciate a little bit of the heads up, because so there are a couple parts to this. One is We have to remember that this is a virus, and viruses, they naturally mutate. Every time they replicate, there's the chance that they might mutate. And some mutations might be more concerning, either more to create greater transmissibility, meaning that it's more catching. Others may have that, as well as might be more deadly. And so mutation is a natural part of a virus, any virus. Coronavirus is just one of those that we're obviously most focused on. So will we need to consider boosters for different variants? I think so. The question is still being determined is how long, what is the durability of current protection for the antibodies that our bodies generate after getting these vaccines? What is the level of protection that those antibodies provide against the initial strain of the virus, as well as these multiple new strains that we've seen? There's the UK variant, the Brazil variant, the South American variant, the USA variant. So these are still, studies that are underway as we speak. We're looking at the scientific method and process play out in real time. So I do think that there will be boosters needed. I'm not sure what that frequency is. I don't think anybody can say for certainty, but it is definitely something that I would have on the radar screen as potential for perhaps it's an annual booster, similar to what we do with the flu. Maybe it's not. So time will tell with that. But I think that boosters, either to boost our immunity or to help with various strains as they develop, might become, again, might become the norm. And then the other part of the question, I think, was, well, aren't we just selecting for more dangerous variants? Aren't we, and I would say that, we need to get to herd immunity, as quickly as possible to help prevent the number of mutations that might come out in as quick of a time as we've seen in the past year. And so the more quickly we can get to herd immunity, the fewer of these strains, hopefully, that will come out that are more contagious and or more deadly.
A related question to that, Doctor, and it won't take long, is how long the vaccinations last. Can you speak to how long the vaccinations last, be it Moderna or Pfizer? So, do we yet have a sense of how long the efficacy of the vaccine lasts?
So it's a great question. At this point, so I'll share some personal story. So I was vaccinated with Moderna in January and February, 4 weeks apart. And so I have the New York State, I think it's the Excelsior Pass, whatever it is, that says that I'm technically covered for 3 months following that, which expires the end of this month. There has been an extension of that, so that I believe it's now up to 6 months or longer. So at this point, the data is being looked at. There is absolute strong evidence that 3 months you're fully protected, and the belief is that it is at least 6 months and likely much, much longer. I think the challenge, I know Dr. Burstein alluded to this previously, is that because we've only started vaccinating very large numbers of folks late December to January, the studies did include 40, 50, 60,000 individuals, but those are not necessarily large enough for these lengthy studies that to help determine the absolute effectiveness of how long these antibodies last in our bodies and how much they protect against the variants. So again, I believe it's at least 6 months and likely much longer. And so we need to continue watching the vaccine manufacturers, as well as what the CDC and FDA recommend in terms of the length of protection, the durability of protection, and then what we need to do with variants as they become more predominant in our communities.
Thank you. So there's a couple questions here around clarification on the paid leave for vaccination. So New York State, you must provide at least 4 hours pay for vaccination. Isn't the federal silent on the number of hours allowed? And there was another question I want to confirm, is it 4 hours of paid leave per dose? So I'll leave that to you guys.
Sure, Dottie, let me answer that.
Okay.
Take the second part first. Yeah, it's 4 hours per dose. So if the employee gets the Pfizer Moderna vaccine that takes 2 doses, they're entitled to 4 hours for each dose. So up to 8 hours total. The federal laws, again, which are voluntary, but it still only apply to those employers with fewer than 500 employees if they choose to. The hours limits are 80 hours over a 2-week period or up to 12 weeks. So in both cases, they provide for more than enough paid leave to cover, getting 2 doses of the vaccine.
Excellent. These are 2 interesting questions. Is it contradictory for an employer to ask? Is it contradictory for employees to ask questions to explore their fear about vaccines to an employer when at the same time the prevailing legal guidance is that employers should not get involved in employees' personal health information? So, the tension between what Dr. Burstein was saying, which was, allow people to sort of ask questions, and the fear of sort of crossing a line. Jim, what do you think that's something that people need to be concerned about?
I really don't think that's something you need to be concerned about. In that case, you're talking about an employee asking for information about the vaccine, going to the employer and saying, I have concerns, I'm not sure if I want to get it or not. And the employer is entirely free to provide information to the employee or direct the employee to where he or she can get information. And that's perfectly acceptable. What the employer should avoid doing, though, is, of course, asking or soliciting personal health information from the employee. That's what the employer should not do. But they're perfectly fine with providing information about the vaccine or where the employee can go and find it.
And just a point of clarification: what about people are told by the doctors not to get the vaccine because of their medical condition?
Right, and that's what I mentioned earlier on. If an employee does object or say they have a medical condition which prevents them or puts them at risk, they should not get the vaccine. That is the situation where then the employer has to explore and determine whether or not they can excuse the employee from being vaccinated. In other words, whether they can accommodate them. And that's where they really have to get into the specifics of the employee's medical condition and what they can or can't do to accommodate the employee. And I'll just add, in that case, the employer would be able to ask for information about the employee's medical condition in that case, so they could make that assessment.
And I was just going to add, if I may, I think that James makes some really good points. And in terms of the vaccines, the currently EUA vaccines, the only absolute contraindication right now is if one has had an anaphylactic, which is a severe allergic reaction to the vaccine, which means you had to have at least one of them. There are other instances that timing may come up. So if somebody is immunocompromised, meaning that their immune system is not as strong as it might be due to a medical condition or due to treatment for a medical condition, there may be a timing such that they shouldn't receive the vaccine in the next X amount of time, a month, 2 weeks, 6 months, whatever that might be. So it's not necessarily that it is a forever contraindication given their health status. It's just something that is for the time being. So that's something that I think would probably need to be, and James, I'd lean on you, but that's something that, patients and their doctors might be aware of. And it's something that just to consider without being really wanting to delve into the specifics of the medical conditions, but just something for an awareness sake that, the only absolute contraindication is for an anaphylactic reaction, but there may be timing issues to consider as well for future vaccine opportunities.
Sure, and Dottie, if I could add kind of a corollary to this is the employee who may object simply because they don't have enough information or they're fearful for some other reason, but they have no medical condition or no religious objection. It's just a personal concern. And legally, those people are not protected and have no legal basis to object to being forced to be vaccinated if the employer were to require mandatory vaccinations.
Okay, excellent. I think you've answered this, but it's being asked, so we probably ought to reinforce it. Is it okay to ask for proof of vaccination in relation to paid leave? If you ask employees whether they're vaccinated, can you ask for proof as follow-up?
Yes, you can. You can ask for proof that if you're giving paid leave, you can ask for proof that they've been vaccinated. And even if the employee has not taken paid leave, and let's say they got it after work or on the weekend, totally on their own, and you just want to do a survey of your employees of who and who is not vaccinated, you can ask employees to tell you whether or not they've been vaccinated. But again, if whatever their answer is, you need to maintain that as confidential.
This next question, I've heard some of this about vaccine hesitancy, that there are people who are working remotely that are worried that if they get the vaccine, they're going to be required to return to work. And so that's a reason why they want to stay working remotely. Therefore, they don't want to get the vaccine. So I've heard that, and as a concern, and that lines up with this question, which is, are those who are working remotely as a reasonable accommodation due to a disability required to return to work after being vaccinated?
That's a good question. And that's going to depend on the individual circumstances. So if someone has been working at home as a reasonable accommodation and they are now vaccinated, you have to consider, do they need a continued accommodation? If they're vaccinated and protected, the reason that they had that initial accommodation may no longer exist, which would mean you may be able to require them to come into the office. So that's something that would have to be looked at on a case-by-case basis and consider the particular facts. But certainly if someone gets vaccinated, that may change the dynamic and what you have to do.
Thank you. So doctor, this is for you. I was COVID positive in November and was fortunate to be largely asymptomatic. What is the rate of reinfection after testing COVID positive versus the rate of reinfection after vaccination? Is there any significant data on this yet?
Such a great question. So the short answer is I'm not aware of any significant data on this. I think that when we look at folks that had COVID, and first of all, I'm so glad you didn't have any significant untoward illness related to it. So thank goodness for that. The amount of protection that natural infection gives from an antibody response is quite variable as we learned. And it's hard to tell what the length of protection is from what we'll call a natural COVID infection. And so that's why folks that have had a positive COVID test are absolutely encouraged and should get vaccinated. And the recommendation is, 90 days or more after, 3 months or more after their onset of that illness. So it's very important to definitely do get vaccinated, after that specific length of time. So again, I think that this question really fits under the it's being studied, it's being understood, comparing the length of quote unquote natural immunity to the immunity that the vaccines give. There are some studies where it definitely shows that the vaccine immunity is better, it's broader, and it's more durable. But really, to get down to some of those details, I think you're looking for, we're still looking for that.
And this is a follow-up to that. Dr. Perry, would you anticipate specific / unique booster shots based on the initial type of vaccine received? So again, the short answer I think is yes. We have to remember that, for these vaccines, they incite antibodies against the spike protein. That's that protein that sits right on, if you got the virus, it sits on the surface and does all, it's what gives the name corona to. And so as the, variants continue to occur, there are likely to be changes in that particular spike protein or other aspects of the virus shell that we need to work on targeting more strongly with our vaccines to create an antibody response that's specific to any of those changes. Right now it appears that the vaccines do have good effect against even some of these quite concerning variants. But again, more time and studies are needed. We've seen reports that Pfizer is looking into, I know there was a comment earlier that Pfizer is looking into the need for booster doses, that I know Moderna is looking at that.
And so I think that over time we will likely have boosters that might target strains a little differently. But again, we need to really understand the current effectiveness, what strains are out there now, what's the prevalence of those, and how we can best ensure protection for all of us.
Thank you. There's an excellent question here. It says, we are not requiring vaccinations from our employees, but we have an employee who is still working from home and has told us they would feel more comfortable returning to the office after they get vaccinated. Since they told us this, can we continue to get updates from them of whether or not they have been vaccinated?
I think that falls to me, Dottie.
Yeah.
I think under those circumstances you can, because as I said before, it is permissible for employers to ask employees if they've been vaccinated. And this employee apparently has indicated, a willingness to be vaccinated. They're just waiting. So I think in those general circumstances, the employer can inquire periodically for an update.
So we're going to make this one the final question here, which goes to some of the skepticism again. And I think both of you can weigh in on this before we close up. It says Cornell University and Ithaca College are now requiring all staff and students to be fully vaccinated. I believe that some of the concern around COVID-19 vaccines stems from the fear that it could be made mandatory by employers and schools, particularly after New York State stopped allowing religious exemptions as they related to the varicella vaccine. Many of us are of the generation or children of the generation which saw an uptick in birth defects connected to thalidomide. How are we so sure that the COVID vaccines are safe in the long term? So, Doctor, you wanna take that?
Sure, and it's such a great question, and I think it gets to some of the heart of a lot of what we've seen regarding vaccine hesitancy and vaccine concerns of individual rights and freedoms versus needs of society and protection. And what is and so I know, James, we'll get to you in a minute too, but as a person in society, do I have don't I have the right to also assume that others around me are relatively safe as well? So I think it's such an interesting question. So I know Dr. Burstein mentioned this as well. So first of all, there are very strong and sensitive mechanisms in place to follow and track. It's the VAERS system to follow and track any potential side effects. With these very serious and concerning cerebral, meaning brain blood clots in the brain. That was detected currently at a rate of about 1 case per 1 million given doses, one case per million, which is very, so it's very sensitive. There have been many individuals who are pregnant, who have gotten the vaccine, and to date there have been 0 reports that I'm aware of any concerns regarding birth defects or others. And absolutely, thalidomide was just a horrible story that played out for far too long, in my opinion. So at this point, we have to look at the safety mechanisms in place, the fact that there has been nothing reported in this, and the fact that we have to balance the potential risk versus of getting sick. And we know that specific to women who are pregnant, that the risk of COVID is higher. There's a higher risk of blood clots, of other types of medical conditions with COVID. So, and those are real, and those are now. And generally with vaccines, we do see side effects within the first few weeks or a month of that. We haven't seen long-term side effects related to vaccines of the magnitude described. So again, obviously more research needs to be done, but everything to date points to safety around that particular question. I want to make sure I answered the question, but I know, James, you must have some thoughts too.
Sure, I'd like to add, there are mandatory vaccine requirements in New York State, mainly for school-aged children, and I think the state policy has been that those mandatory requirements are only put in place, after the science has determined that, those vaccines are safe and effective. So we may very well see something like that from New York, especially for school-age children, perhaps coming this fall to get everybody back in school. I'm going to step outside my bounds just a little on the thalidomide area. Dr. Perry, please correct me if I'm wrong, but I just want to make sure people understand this. If I understand correctly, if I remember, thalidomide wasn't a vaccine. I think it may have been something that was prescribed for pregnant women for morning sickness or the like. So just want to make sure people don't conflate, two different things and create an unnecessary fear from something. So I think that's correct, Dr. Perry, isn't it?
Yeah, absolutely. Yeah. So thalidomide was used as an anti-nausea medication, and it was prescribed for folks, I believe, beginning in the 50s. It was some anti-nausea medication, and as far as I understand, it only affected it affected fetuses within the first, I believe, 8 weeks of actual pregnancy. So it was something that was given for morning sickness as well as general nausea, and it's a medication. One of the things, I know we're at time, but one of the things that has been talked about a lot is, well, what about treatments or medications or other things that can be used for COVID-19 as well? And vaccines are very safe. We have to look at the long history of vaccine safety, and we know that medications, given over long periods of time, it can have many other side effects as well. So in this regard, that's where we believe vaccines are really the best way out of the pandemic as we see it right now.
Well, thank you all very, very much. I want to thank Dr. Burstein, Dr. Perry, and James Grosso for your time and expertise. I really appreciate you sharing it with us. We also want to thank our series sponsor, Highmark Blue Cross Blue Shield, for helping us present this important conversation to the business community. Please visit our website, thepartnership.org, our event page to register for the session. Can you hear me now? Okay, sorry about that. And I want to thank everybody for attending today's session, and we really look forward to our conversation next Friday as we focus on how businesses can create effective vaccination policies and plans. So thank you all for being here today, and have a great day.